Prophylactic in terms of cancer. Prophylactic is a term that generally refers to something that is intended to prevent disease or some other undesirable condition. In the context of medicine, it often refers to measures or interventions taken to prevent the onset of a disease or condition before it occurs. In the context of cancer, prophylactic measures are those taken to prevent the development of cancer or to reduce the risk of cancer occurrence. These measures can include lifestyle changes, medical interventions, screenings, vaccinations, and more, as described in the previous response. The goal of prophylactic measures in the context of cancer is to minimize the likelihood of cancer development or to detect cancer at an early, more treatable stage. Here are a few examples of prophylactic measures in the context of cancer. Lifestyle changes. Adopting a healthy lifestyle can help lower the risk of several types of cancer. This includes maintaining a balanced diet rich in fruits, vegetables, and whole grains, engaging in regular physical activity, avoiding tobacco products, limiting alcohol consumption, and practicing sun safety to prevent skin cancer. Vaccinations. Certain vaccines can protect against infections that are linked to an increased risk of cancer. For example, the human papillomavirus, HPV, vaccine can help prevent cervical and other cancers associated with HPV infection, and the hepatitis B vaccine can reduce the risk of liver cancer. Chemoprevention. Some individuals at high risk of developing specific types of cancer may be prescribed medications to lower their risk. For example, women with a strong family history of breast cancer might be considered for chemo-preventive drugs such as tamoxifen or raloxifene. Prophylactic surgery. In cases where individuals have a very high genetic risk of developing certain cancers, they may choose to undergo prophylactic surgery to remove organs or tissues that are at risk. For instance, some individuals with a strong family history of breast and ovarian cancer may opt for prophylactic mastectomy, removal of breasts, and/or prophylactic oophorectomy, removal of ovaries and fallopian tubes. Regular screening and surveillance. Regular screenings can help detect cancer at an early stage when treatment is more likely to be effective. For instance, mammograms are used for breast cancer screening, pap smears for cervical cancer screening, and colonoscopies for colorectal cancer screening. Genetic counseling and testing. Individuals with a family history of certain types of cancer may undergo genetic testing to identify specific gene mutations that increase their risk. Genetic counseling can help them make informed decisions about potential prophylactic measures. It's important to note that while prophylactic measures can be effective in reducing the risk of cancer, they may not eliminate the risk entirely. The appropriateness of different strategies varies from person to person based on their individual risk factors, medical history, and genetic makeup. Consulting with healthcare professionals and specialists is crucial for making informed decisions about cancer prevention strategies.